All right, good morning, everyone. Welcome to the monthly Southside Wellness Coalition meeting. You are being recorded. We have a wonderful agenda planned for today on December 15th. I'm going to go ahead and get started. Share on the screen. Okay. We're in here person as well. Here. All right, we're going to start out with the minutes from the last meeting, 17th, which will be shared on your screen in front of you. So last month, on November 17th, we also had a hybrid meeting. Again, that means you have the opportunity to come at Southside Behavioral Health Administration Building or join us via Zoom. You can see there that our minutes are then monthly placed onto our meeting blog on our website, www.bewellsouthside.com. You can see there that, again, members present, members on Zoom, announcements. October were approved by members of the coalition. And of course, here you see the topics that were discussed at last month's meeting. If you'd like a copy mailed to you, let me know. Please also, of course, go in our monthly newsletter along with the recorded session that we had last month. I need to please either in person or via Zoom to make a motion to approve November 17th minutes. Can I get a motion verbally or in the chat box?
I'll make a motion.
All right, Stephen motions here in person. Can I get a second in the chat box or turn on your mic?
I second.
Thank you, Jennifer. I appreciate it. All right. Awesome. All right, so then we'll go ahead and look at that was also shared out as part of the outreach and reminders to you all, but in case you don't have a hard copy there in front of you, we are having a December 15th, again, the option of being Zoom. And today we have guest speaker, which we're going to start with Tamika Tony in just a few minutes. We're happy to have her joining us this morning. And after her presentation and time for questions, and move to our talking about the leadership team nominations. Of course, in January, the coalition will be election for members of the leadership team, and then followed along talking about participation, our virtual Creating Trauma Sensitive School. Again, these two major events coming up in February. Getting a report from the Trauma Informed Care Network that we've been helping support, and then some additional information about training opportunities. Okay, so that is our agenda for today. All right, and again, joining us, I know a few people came in. All right, please make sure joining us, if you would mind dropping your name into the chat box to introduce yourself. So we have that information to us. All right, and if there are any questions at this point, if you would mind dropping them in the chat box or turning on your microphone before we move to our guest speaker. All right. Right. Awesome. Okay. All right. Well, it's my to introduce now our guest this month, Tamika Tony, Community Engagement and Partnerships Coordinator, Suicide Prevention for Veterans Health. She's going to talk to us this morning. Welcome, Tamika. We're so glad to have you.
Thank you very much. I am just grateful for this opportunity to talk with the Southside Wellness Coalition on the Suicide Prevention 2.0, which is a public health approach that looks at community-based intervention with the clinical-based interventions as well. So I wanted to be mindful of the coalition's time this morning. So I will get started. Let's see here. I'm going to share my screen. Okay. Excuse me 1 second. I may have to. Having a little technical.
There we go. It's coming up. It's coming up now.
Is it coming up? Okay. Are you able to see the presentation?
Yes, as we discussed, see the first slide. There we go. Yep. There it is.
Okay. All right. Thank you. So today I'm going to touch base on, and can you hear me okay? Okay, great. Today I'm going to touch base on community-based interventions for suicide prevention, along with the Community Engagement and Partnerships Program known as CPC, which is the current title of my role. This is an overview of the presentation today, suicide prevention from a public health perspective. We'll look at some key data. We'll also look at the public health strategy, along with the community-based interventions with the clinical base, and review some suicide prevention resources if we have time. Suicide prevention, which we all know is a public health issue. Suicide is a national public health issue. VA has made suicide prevention its top clinical priority and has implemented a comprehensive public health approach to reach all our veterans, including those who do not receive VA benefits or health services. Our veteran VHA users all have unique experiences. Some of those are economic disparities, service connection, homelessness, health and well-being, and social connection. These unique experiences are highlighted as they put our veterans at a greater risk for suicide. And as VHA staff, we assist with questions about treatment options, linkage to community resources to promote social connectedness, helping with housing, employment, and the service connection process as well. Now we're going to take a look at some key data. This slide right here represents an attached, it has some reports online as well, but this slide is the 2020 National Veteran Suicide Prevention Annual Report. And in that report is also the state data sheets. This year report suggests that the steps the VA has taken to prevent suicide have made an impact. However, as we all know, there's still much work to be done. The report uses the most recent and comprehensive information regarding veteran suicide, including data updates from the Department of Defense and Centers for Disease Control and Prevention. As part of the VA's 2020 National Veteran Suicide Prevention Annual Report, VA has released its statewide suicide data as well. So the state data sheets here also examines all 50 states, along with DC, Puerto Rico, and our US territories. This slide looks at the average number of suicides per day among all US adults, including veterans. The average number of suicides per day rose from 81 per day in 2001 to 121 in 2020. The average number of suicides per day among US adults was highest in 2018 at 127 per day. And as we all know, one suicide is one too many. The average number of suicides per day, veteran suicides per day, rose from 16.4 in 2001 to 16.8 in 2020. It was the highest in 2018. Of the, on average, the 16 veteran suicides per day in 2020, approximately 39.7% were among the most recent VHA users, and 60% that averaged out to 10 per day were among veterans who did not use VHA services. The next slide talks a little bit about suicide deaths and methods, 2020, and the changes from 2001. So what we have learned is that among veteran suicide deaths in 2020, relative to those in 2001, there was an increase in the percentage involving firearms that, as you can tell from this slide, was up 4.5%. Suffocation was up 0.9%. There were decreases for those involving poisoning that was down at negative 4.8% and other means. For suicide deaths of non-veteran U.S. adults, there were increases from 2001 to 2020 in the percentage involving suffocation. From 2019 to 2020, among veteran suicide deaths, the involvement of firearms increased from 69.5% to 71%, while poisoning and suffocation involvement decreased from 8.5 to 8.4. In 2020, firearms were involved in 72.1% of suicides by male veterans, and that's up from 70.6% in 2019, and in the 48.2% of suicides by female veterans, down from 48.4% in 2019. This distribution of methods involved in suicides by non-veteran U.S. adults changed from 2019 to 2020. While we've seen some progress, here are our anchors of hope. We still know that there's work to be done. As you can tell from this slide, 343 fewer veterans died from suicide in 2020 than in 2019. Our number of veteran suicide decreased in 2019 and 2020, with the lowest number of suicides since 2006. Our age-adjusted suicide rates in 2020 were the lowest since 2016 for veteran men and the lowest since 2013 for veteran women. From 2018 through 2020, adjusted rates for veterans fell by 9.7% as compared to 5.5% decline for non-veteran U.S. adults. And despite onset of COVID-19 pandemic in 2020, age and sex-adjusted suicide rates among veterans fell 4.8% from 2019 to 2020 versus the 3.6% decline among non-U.S. veteran adults. Again, while we've seen some progress, there's still definitely work to be done with our community. As this slide here, you can see suicide prevention, as I stated before, is everyone's business. One suicide is one too many, and the work continues with all of us. Our veterans live, work, and serve in all aspects of our community, our nation, and the world. The issue of suicide in the U.S. also affects everyone. This is why we're working with an extensive network of community partners across the country to prevent suicide among all veterans, including those who may never come to the VA for care. We all are aware that no one system can prevent suicide. It is everyone's responsibility. And as such, the VA has embraced this comprehensive public health approach to reduce veteran suicide rates, one that looks at beyond the individual to involve peers, family members, and the community. We know we cannot do it alone, as roughly half of all our veterans in the U.S. do not receive services or benefits from the VA. This means that we definitely must and are collaborating with our partners and our communities nationwide to use the best available information and practices to support all veterans, whether or not they engage with the VA or not. And so here are some continuing to increase the impact for suicide prevention, making sure we're reaching our veterans and their families. We're building community engagement, changing the conversation around suicide, and developing those innovative and preventing strategies. Now I'm going to talk a little bit about suicide prevention public health strategy. Here, this slide is showing that suicide is a public health challenge that causes far-reaching pain among individuals, families, and communities across our country. Suicide is preventable. Veteran suicide is an urgent issue. along that's in the U.S. Department of Veterans Affairs, along with our stakeholders, our partners, and communities nationwide that we must address. The VA highly supports the national goal of reducing the annual suicide rate in the U.S. by 20% by the year 2025 and is implementing this public health approach to achieve this mission. The VA has definitely undertaken substantial veteran suicide prevention efforts. VA's public health approach for veteran suicide prevention incorporates long-term community and clinically based initiatives as part of the Suicide Prevention 2.0 initiative. As you can tell from this slide, the community-based approaches includes our Veteran Integrated Service Network, based community coalition, and collaboration building. Veteran to veteran coalition building, state-based coalition and collaboration building, evidence-based psychotherapy interventions for suicide prevention under the clinically based interventions that involve cognitive behavior, problem solving, and dialectical behavior therapy and safety planning interventions. Now we're going to take a look at Suicide Prevention 2.0 that speaks a little more to my role with as the community engagement and partnerships coordinator. As you can see here, these are the focus priority areas that we would look at under that model. The three focus areas are identifying service members, veterans, their families, and screening for suicide risk, promoting connectedness and improving care transitions, and increasing lethal means safety and safety planning. The National Strategy for Preventing Veteran Suicide provides a framework for these priorities, organizing efforts, and contributing to the national focus on suicide prevention. Suicide Prevention 2.0 community-based intervention promotes these priorities areas and emphasizes their critical 6 elements in alignment with the national strategy, and therefore state, regional, and local teams are encouraged to use these priorities as key elements in their suicide prevention strategic plans. Here we have some of the community-based interventions, again, that speaks to this model, starting from the national level to the state level, along with the community engagement to community level, and also with outreach and education. With looking at the models of identifying veterans, asking the question, this enables culturally competent care and access to resources. It allows our community members, families, and community service providers to connect individuals to the appropriate care. Suicide risk screening in healthcare settings, which is also important, allows our providers to recognize and prevent self-harm. For promoting connectedness and improving care transition, this is where we look at connectedness to others. That's also including family members, co-workers, community organizations, and social institutions. These are all very important factors. Increase of lethal means safety and safety planning. Limiting access to lethal means during periods of crisis can make it more likely that the person will delay or survive a suicide. Completing a personal safety plan is a clinical intervention that can help our individuals manage and decrease suicidal feelings and help them stay safe when these feelings occur. Here, again, it speaks to the community-based interventions for the suicide program. These are unique models that are aimed to reach veterans through multiple touch points from national to community levels for all our community-based efforts to end veteran suicide. The Community Engagement and Partnerships program comes out of the Office of Mental Health and Suicide Prevention, our National Suicide Prevention Program. The University of Pittsburgh's Program Evaluation and Research Unit has partnered to spearhead the community-based suicide prevention intervention pilot programs. Right now, for the Community Engagement and Partnership coordinator position. The position has actually expanded to all VA medical centers, and everyone, if not, is in the process of ensuring that they have a community engagement and partnership coordinators at each VA medical center at this time. Now I'm going to speak a little to the community engagement and partnerships program. The suicide prevention team integration and coordination. The role of the community engagement and partnership coordinators, our role is to establish new community coalitions, support existing coalition. We are here to facilitate new community, regional and state level efforts to implement evidence-based, community-based suicide prevention practices. We work very closely with our suicide prevention coordinators. As you see, their role is enhanced care management of veterans at high risk of suicide, facility suicide prevention coordination, the Veteran Crisis Line, serving as a facility consultant, community outreach and education, and facility suicide prevention training. So we work very closely with our suicide prevention coordinators, combining community and clinical interventions. The CPCs, we also serve as subject matter experts in public health approaches with the coalition leadership and management of other community-based models for suicide prevention, reaching our veterans. Here gives another overview of the community engagement and partnerships coordinator to enhance and expand with current VA suicide prevention, be an active member of our local VA suicide prevention team. Again, I work very closely with our local suicide prevention team. Educational suicide prevention, building that coalition network, actively working with key stakeholders at the community, state, and local and vision levels as well. This slide again speaks to, again, some of the key roles of the community engagement and partnership coordinators: developing, facilitating, strengthening the community-based intervention, suicide prevention at that community, state, vision levels, collaborating with our VA programs and community stakeholders, providing leadership for coalition management, disseminating program evaluation and surveillance data as well. And for successful coalition builders, it's important that we all, as members, actively participate in this approach. To carry out this important initiatives, we tap into existing partnerships as well as act as instrumental parts in planning new suicide prevention coalitions to more broadly disseminate information about suicide risk awareness and how the public participates in keeping our veterans safe and access to resources. My role is to work very closely with our community partners to find out what the needs are around veteran suicide prevention and making sure that we're putting strategic plans in place. Again, we all know that suicide is everyone's business. One suicide is one too many. Working with the community, as we understand that our community partners are the expert. You guys are in the community, and we know that you know and recognize the needs that are there. And so we want to make sure that we're implementing those plans to help prevent veteran suicide. These are some of the anticipated outcomes. As you can see here, we have some of the short-term objectives, which is enhancing the prevention networks, increasing engagement with our veterans, increasing and reaching and adopting the model, reducing those gaps that you as a community partner see in the community based on with our suicide prevention systems, and improving community climate outcomes. Some of the intermediate objectives: increase formal help seeking, use of help care, increasing referrals from multiple sources, making sure that there's no one door that's available There's several doors that are available that our veterans can seek in the community as well. Improving those treatment engagement and retention among veterans seeking care, community collaboration around veteran suicide and suicide prevention, making sure that there's increased access to safe firearm storage options as well. Reducing veteran suicide deaths and attempts, reducing all-cause mortality, and reducing suicide ideation. Here we have a list of some of our VHA suicide prevention resources. Here's the crisis line. You know, this crisis line is for veterans, service members, family members, friends, co-workers, community providers. Please do not hesitate to use this crisis line if you or anyone know that there is a veteran in need. Making the Connection. This is an online resource that veterans are telling their stories about overcoming their mental health challenges. VA SAFE training. Our suicide prevention coordinators provide VA SAFE training in the community. This is in collaboration with Psych Armor Institute. And again, we do provide VA SAFE training as well. Coaching into Care, which is a primarily telephone service, which educates, supports, and empower our family members and friends who are seeking care for veterans. The Be There prevention initiatives shows our veterans loved ones that you care. BeThereForVeterans.com is definitely available as well. Our social media safety toolkit. This social media is an important intervention channel. It's a key piece of VA's comprehensive community-based prevention strategy. It's there for our veterans, their families, and friends as well. And it's the knowledge needed to respond to social media posts that indicate a veteran may be having thoughts of suicide. This toolkit definitely has the best practices, resources, and sample resources. We also have the Lethal Means Safety Toolkit. As you can tell from this slide, that was developed in partnership with the American Foundation for Suicide Prevention and the National Shooting Sports Foundation. This toolkit guides communities through the process of building coalitions to raise awareness and safe storage in its connection to suicide prevention. The Lethal Means is, as I presented earlier, is one of the priority focus areas that we look at with this initiative. So lethal means safety and safety planning. This is another slide here that talks about National VA Suicide Prevention Lethal Means Safety public service announcements that you guys are able to see on the YouTube video. From Science to Practice, in 2019, VA launched a literature review series to help clinicians put suicide prevention research into action. The series translates evidence-based research into informative and practical steps and helps support our veterans, veteran patients. It's updated monthly. Together We Can recently launched some new suicide prevention informational series for veterans, their families, and caregivers as well. This series is backed by scientific findings designed to provide families and caregivers with resources and practical steps to take to be there for veterans in their lives. Resources for clinicians. We have our suicide risk management consultation program. This is with VA DoD clinical practice guidelines, which includes assessment and management of patients at risk for suicide. Staying connected. This is how you can follow us on social media, U.S. Department of Veteran Affairs, Veteran Health Administration, making that connection as well. Train Learning Network provides quality training opportunities to over 1.8 million professionals who protect and improve the public's network. Many of these trainings are used for internal VA staff and training clinicians that are including on this public portal as an opportunity to train community providers. The suicide prevention programs wants to ensure the high level of training provided to VA employees is also accessible to those assisting veterans in our community. So this is also a great resource as well. Here are a list of references. Don't want to go too far into that. Thank you so much for allowing me to present today. And are there any questions? And I hope I didn't take up too much time.
Hi, Ms. Tony. My name is Liam. Thank you so much for being here today and for, raising awareness and all the work you're doing in trying to mitigate and prevent suicide within the veteran population. I also, wanted to thank you and highlight your example of this issue as a public health issue. And so I work on the housing side of things, and I see specifically with a lot of the HUD VASH vouchers and even some of the transitional housing programs, there are just so many barriers to veterans being able to utilize the resources. So they have to document their chronicity of homelessness, and they have to complete the VI SPDAT, and then if there are any sort of substance use issues or underlying things going on, then they could very likely be denied or exited out of transitional housing. So with that, are there any sort of initiatives to kind of address the more systemic issues and reduce the barriers to veterans accessing some of these maybe preventative services?
Yes, the VA has, as you mentioned before, several homeless services for our veterans. There are certain, criteria there and eligibility, but they definitely are in the process and continue to try and streamline those services to make them a little more accessible. And I think working with our community providers, again, making sure that they have access to the services to be able to apply for those services and having those services streamlined.
Thank you.
Mm-hmm.
All right, other questions? You're welcome to drop them in the chat if you're not able to turn your microphone on.
Well, thank you very much for the opportunity. Hopefully I'll be able to continue to do this work with the Southside Wellness Coalition. Look forward to working with everyone.
Let me ask you a question,
Sure.
Tamika. I'll follow up with a question. Others have questions. As a coalition with a strong leadership team and now meetings having a strong online presence, where can we start as a coalition? We certainly have a committee for mental health. We do sponsor our prevention side trainings in the area. When we start as a coalition, we certainly would like to do more for our local veterans. Where would you suggest we start with that?
I recommend just one kind of implementing doing a needs assessment to see what services that you have in your community, what services are provided in the community, because what that will do, the needs assessment will give you a good idea of what you feel you need to continue to serve the veterans in your community. Every community is unique in itself, and different communities have different needs when it comes to providing services for our veterans. So the first thing that I recommend is definitely conducting kind of that needs assessment to see what's there, and then that will put you in the direction of kind of next steps of being planning things strategically.
Awesome.
So
Okay.
what organizations are in your area, what services they provide. So it'll give you an idea of the services that are available and the services that you feel you need to bring into your community.
Okay, so then we could reach out to you to set up another meeting, a follow-up meeting with you to talk about that, or a sample needs assessment with you.
Absolutely.
All right, wonderful, wonderful. On the call today, if you wanted to be part of that next step meeting with Tamika, if you'll drop a box for me today, that would be great. And then, of course, I will also follow up with our minutes and reach out to membership and other local supporters. See if you'd like to be in the follow-up conversation with Tamika as how our coalition can be helping to support our local veterans. All right, and thank you, Tamika. We greatly appreciate you joining us today. A lot of really wonderful information that we do need to share. Will you be able to send me your PowerPoint presentation to send out to folks?
Yes, yes, I can do that. And thank you so much again to the Southside Wellness Coalition. I appreciate the invite, and grateful and happy to come back.
Awesome, awesome. We will definitely be in touch. Thank you so much.
All right, happy holidays, and you guys take care.
Thank you. Same to you. All right, folks. So as I said, I will be sending out with the minutes as well as an outreach to members. So those of you that would like to be a part of the team, the mental health committee, to follow up with to create a plan. Again, she's suggesting needs assessment in our area, reaching local veterans as well as reaching out to see what services are available. All right, any questions before we move on to our next item of agenda? All right. So next item of agenda is our leadership team nominations. As you know, leadership team elections during our January meeting. Monkey, we are 4 at the moment, and so for those 4 vacant seats are Patrice Clayton of Blaze Advisors, Liam Hudson of the Lean Project, Sergeant Amy King of Mecklenburg County Sheriff's Office, also the SRO office, Mecklenburg County High School, and Stephen, current leadership team member right now. So all 4 of those individuals have graciously accepted their nominations, so super excited about. And then therefore, January meeting, I will be a monkey link to all members so that you can go in and vote the new leadership team members. If you have not nominated someone and you would like to, the floor is still open for nominations until January 1st. So if you want to talk today, or if you want to call or email me at your earliest convenience and let me know who you would like to nominate, I will then do that for you and send out that notice to the person you have nominated to see if they'd like to join on the leadership ballot in January. About that, if you'll turn on your microphone, if you want to make a nomination right now. All right, next item our agenda is the Community Anti-Drug Coalition National Forum. February, we did receive funding to send 3 leadership team members. We're happy to report that Stephen have accepted that invitation. So we look forward to their exciting times and ability to work with other folks from other coalitions across the nation, beginning at the end of January, early February. So we keep our fingers crossed that that's not a snowy time for us this year. Any questions about? All right. The Tick-In, our local Tick-In. There was an announcement. I had only 3, it's actually 2. We have the opportunity to send 2 leadership team members from the Tick-In to the Creating Trauma Sensitive Schools Conference in Texas this year. I will be reaching back to the serve on that leadership team to find out who will be attending. Those spots right now are current. All right. If you are interested, again, the committee that supports the Trauma Informed Care Network, led by leadership team member Marianne, their next meeting is December 21st, which is next Wednesday, at, I believe, 1, 2 o'clock. If you're interested in being a part of that team, developing the Trauma Informed Care Network, you can drop it in the chat box or send me an email or give me a call. I love phone calls too. Let me know you'd like to attend the TICKN meeting on the 21st of December. We're making plans again for the new year. I don't think, let me check, Mary is joining us today. All right, so I just made that presentation on her behalf. All right, and then that brings us next to our youth outreach. Happy to share our LGBTQIA collaboration project. PSAs have been approved and have been developed. We're now currently working with the local marketing to launch those PSAs in our area in early January. Excited about that coming out in January. Please look out for in our January newsletter for Coalition information about the PSAs, access page that we've developed for that, ability to request items of support to show your allyship to our youth and our local community. And that will be a highlight in January. All right. And then finally, 23, well, wrapping up 2022, today we hosted our last prevention training of the year, which was this 3.5-hour suicide course. It was held at the community center sponsored by A&M Families. We had 11 local community join us yesterday afternoon, received. And so be looking for pictures and such that we took at that event. And please let me know when you would like to host suicide. As Tamika brought up, very important to be reaching out to our local folks and getting them trained in suicide prevention. Safe Talk, which is only 3.5 hours, is a great place to start in the community. So if you're interested in sponsoring those, helping me put one in a place, a school, a community hall, wherever we can, and I can set up a screen and a projector, and today it works to go anywhere you go. Please. And then right now, looking forward to 2020, we have an assist training, suicide intervention skills training. We at the Southern Virginia Center in South Boston. That training right now is scheduled to be March 9th and 10th. And after today's meeting, I'll be doing a community-wide announcement of that training, which caps at 20 people. And if you're interested in a seat in that in March, please, again, you can drop it in the chat box and meet email call. All right, now we're time for member updates. Is there a member or a supporter on the call today who'd like to announce something for us?
Actually, could you maybe say something about that ACEs on the 26th?
Oh, yes, yes. Stephen's here joining me in person and I having coffee and cake. You're welcome to join us anytime. Stephen brought up a thing, so I'll segue to January because there are things happening in January and he's outreaches in January. So meeting will be Thursday, January 19th. One really great thing happening in January is we have been invited to run the alternative ed program and for Mecklenburg County High School to come and make a ACEs presentation. Certified trainers, which are myself and Stephen, Kelly Colgate, Engelhorn, to come on January 20 o'clock in the evening to join and the staff of Mecklenburg County to conduct a family engagement night. We have been in presentation on ACEs. And so if you're interested in joining us, would like to know more about that. Mecklenburg County High School has a flyer that we can then share. But if you'd like to join on the planning team of that, be involved in outreach to the high school, you're more than welcome to, and just drop it in the chat box and meeting. We're super excited about being able to make a presentation. And that's January 26th. And then during our next meeting, I'm happy the state of Virginia has released adult survey information, not but those from 18 to 20. Last year, if you all recall, good job of sharing on social media, a $15 incentive as folks in the community of Southside to answer a question on called the Young Adult Survey. Yesterday, I attended a meeting where the state of Virginia is releasing that information. What we'll be able to do in the January meeting is to show plates connected to substance misuse, young folks in our meeting. By March, April of 2023, they will then send me the information on folks that are specific to Southside, because we did have a number of our South participate in that survey. That is information to share what happened in our January meeting and then the election of our 2023 team. All right, and see, and then two more items if you know that we've been working on behind the scenes in between meetings. As some of our members brought up, creating a crisis, well, not necessarily a crisis, informational card. I know that we the card that says if you need help with, obviously in committee we said people may not be connected to opioids. We are developing another card that I'm able to see this on camera. Al, I'll see Al's going to help me see that. Form. We're developing a wallet site that will have information about our resource here at Southside Behavioral Health. And then also Stephen is on the, we're developing a resource guide. It's in its draft form, a resource guide, very similar to 211. Develop a resource guide that we can give out again at all trainings that lists Southside Behavioral Health, other local resources, all the great quality information that needs resource. We already know going in changes year by year, but hopefully have it out by early March. So again, we're original hard copy items as well as through email, ways to support services. And as presentation to do a needs assessment on veterans. So again, we could develop one of these resource cards specifically targeted at veterans. To be a part of the discussion and process of that, please let me know. We need feedback. We need people on the ground as where these resources are included on the substance abuse resources card. All right. I'm checking my table. Make sure. Let's see. I saw something in the All right. And Christy's gotten the Care Award that was on our agenda last month. She and I are be updating and working together to make that deadline. The great. All right. Yeah, I've got that update on the award. And again, if you want to be that Christy and I are having about Care Award that we talked about last month, be a part of that team, please let me know. And we're happy to swing you into the All right, we're going to open the floor one last time for any member updates, comments, questions about the content of this month's meeting. Did I miss anything?
I don't think so.
Stephen's here as my backup. Right. All right, if there are no questions or concerns, we will adjourn the meeting at 10:55 a.m. Again, after review by leadership, we will send the minutes and recorded audio to Foxglove Marketing to post on our Be Well Southside our website. If you joined us this morning and you are not currently following our newsletter, I will be adding you automatically to our Chimp Mail account. So in January, you will receive the Coalition monthly newsletter. Please look for it in your spam. If you decide you don't want to follow it, you can do that. You just have to unclick unsubscribe, but I am going to go ahead and subscribe you today if you are joining our meeting for the first time. So again, thank you all. Hope you have a wonderful holiday. Be safe. I understand it's snowing where my kids are, and it's just safe travels if you've got to go out today.
Merry
Bye-bye.